Hello to everybody joining us, and a warm welcome to all of you who are joining us for the spotlight session on improving routine data and clinical quality with DHIS2. I'm Kirsten Andreasen from BAO Systems, and I have the pleasure today of introducing our speakers, Rodrigo, Amber, and Christina from Population Services International, who I would like to add is a bronze sponsor of the DHIS2 Symposium. In this session, our speakers will demonstrate how DHIS2's features are being used to support remote and in-person clinical quality and data quality assessments and supportive supervision visits. So I know you're all wondering, who are our speakers? First, I would like to introduce Rodrigo Gramajo, who is the Deputy Director of Digital Health and Monitoring and is responsible for the design, deployment, and improvements of digital health interventions at PSI. Amber Sheets is a Senior Technical Advisor for Digital Health and Monitoring at PSI. And Christina Luciana is a Senior Program Manager in the Digital Health and Monitoring Department, and she supports PSI's journey towards better use of DHIS2 as the organization's management information system. It is our aim with this session that you will learn, 1, how to use DHIS2 for M&E routine data quality assessment at health facility level, 2, how to use DHIS2 for assessing and improving quality of health service provision, and 3, what it takes to build DHIS2 common global goods out of experience gathered through implementations at scale. Following the presentation, we will have time for questions and discussion. I encourage you to use the Q&A feature to ask your questions and leave your comments. And now, without further ado, I turn it over to PSI.
Thank you so much, Kirsten, and thank you to everyone who has joined. Good afternoon, good evening, depending where you are. As you can see on the screen, we changed a little bit the title of our presentation this morning as we were discussing it. It's basically what Kristen mentioned is harnessing the power of a global digital good to strengthen digital health ecosystems. And probably you know which global digital tool we're talking about. And we're going to be using 2 examples. One is the example of using DHIS2 and more specifically the data capture app for improving, for doing clinical supervision. And the second one is to talk about how to use, again, the data capture app to improve data quality. And I'm gonna pass to the next one, which has a little bit of the things that we're gonna be discussing today. Where is my presentation? Here it is. Today, when I'm based in Washington DC, and I'm coming to the office. So when I was driving to the office, I passed the FHI 360 offices, and I felt a little bit nostalgic because this is where usually these event takes, or in the before times it used to take place. And I was a little bit nostalgic because I knew I wasn't gonna be able to have everyone, you know, the interactions. But as I was going to the office, also I was thinking of how nice it is to be able to have this remote and to make sure that more people can have access to these presentations, and that we're also using a platform that allows us to have or mimic those human and personal interactions. So anyhow, I'm gonna get into the topic. So first, we're gonna be talking about what's a PSI digital strategy and how do we use and practice the principles of digital development. Then a little bit how we, what's kind of like our process for, I would say process, but also I would say philosophy of coordination of the adoption of digital health solutions in the different countries and markets where we work. And then my colleagues are going to go in depth, I would say, on the 2 examples, one on clinical supervision, and the second one on data quality. And the last one is going to be a call for action. We want everyone who's here in the symposium, but also everyone from the community to be able to collaborate with us. So what's the vision for digital health at PSI? So our vision is to improve consumer health and well-being by using digital technologies, first to increase access and personalized delivery of information, products, and services throughout the life course of our clients, our target audience. We call them Sarah. Sarah is our archetype at PSI. So probably you're going to hear us refer to Sarah during the presentation. She's the person for which we work for. And here, as you can see, we have basically, this is the diagram that summarizes the digital health strategy at PSI. Well, you recognize the pillars. And in this presentation, we're going to be focusing on the workforce and the community health, community influence. However, just to mention, yeah, some of the work that we do on the consumer side has to do with counseling digital counselors or chatbots to make sure that people can, through, let's say, Facebook pages or any other social media means, can access personalized information, signpost them to, again, services or products. But this is complemented by the work that we do under the workforce. So what do we do under the workforce? As you can see, we use mobile technology to improve quality, efficiency, and stewardship of health service delivery and the workforce. So today we're going to be looking at, again, data quality and how many staff can improve this on the ground, and also anyone who's doing assessments on the clinical procedures can use the tool that we have developed. And the second, I would say the third pillar, the community influence, has to do with the way that we are being a player in this community and making sure that whatever we're developing can be used by other partners, not only within PSI. We do not develop things for PSI, but for the larger community. So we'll talk a little bit about how we go about the implementation of this and coordination and collaboration with stakeholders in country, with the different communities of practice, with donors, and everyone else. Let's move to the next one. So probably most of you have seen this and are familiar with the principle of digital development. The reason why I'm bringing this up is because you're going to see throughout the presentation how we first adhere to these principles. Not only we adhere, but we also practice them, and how through these examples and this experience, we have realized that some of these principles are very important, and that they have guided us on the development of our tools. Especially, I would say, for the ones that we're presenting today, I think design for scale, especially using DHIS2, builds for sustainability. In the case of what Christina will be presenting, how we switch to, let's say, a technology that we know is more sustainable in the long term, but also, and I guess in the last one, the call for action is be collaborative, be able to work with the different stakeholders in country, different players in the places that we work. And just to, as I mentioned, a little bit of our philosophy or the way that we go about coordinating and implementing digital tools is about these 4 stages that at PSI we call them the Keystone process. And the first one is we make sure that we're diagnosing what's the need. Without moving forward with the technology, we make sure that we understand what were the needs. And then once we have gathered all the information with all the different people that are involved, we decide where do we need to intervene, what's the intervention, so that we can have the greatest impact. We design with iterative processes, and then we're able to deliver. And I would say at the end of this deliver process, there's kind of like a loop to make sure that the final product, the product that is being used, it's always improved, and it's always improved, and it's fitting the need of the country or the use. And in this case, I'm going to move to the next one. We're going to, as I said at the beginning, we're going to be presenting the case of the DHIS2 data capture app, and how we at PSI, or the group of developers within our team, developed a fork. So added some functionalities or within the data capture app to make sure that we could use some of the functionalities that we needed for our use cases. And here, I just wanted to show how these different tools are how can I say it, are touching or are matching some of the different areas of the digital health intervention, such as provider training, such as planning and scheduling. And I don't think some of you already know some of these tools, so we won't go a lot into those details, but I just wanted to make sure that we cover a little bit of the different areas that we touch. And I think that's it for me, and I'll pass it on to my colleagues who are going to be talking about the theory of change. Thank you.
Thanks, Rodrigo. So with our project, we of course, had a theory of change established. So in the end, of course, we want to achieve a healthier Sarah. Like Rodrigo mentioned, this is our archetype. This is how we envision a client. Through this, we determine that the long-term outcome to lead to this goal, we have provider quality at scale. And so how do we get provider quality and to the areas, to the outcomes areas that we have identified? So it's improving provider performance, so their actual clinical performance, as well as the allocation of supervision resources to support those providers, as well as then data-driven decision-making and facility data management systems. So we need quality data on one side, but we also need clinical quality on the other. And then how do we achieve those outcomes? So the key outputs here are really repeat assessments. We need to have real-time feedback. We need to have frequent visits and supportive supervision. And this is the same for both the clinical quality side as well as the data quality side in order to achieve a healthier client. And Rodrigo also had mentioned the fork application that PSI had built out using the DHIS2 data capture app. And just to kind of show you where we are in the process. So we started this last year in 2020 with our concept note and our initial use cases and our technical requirements for this fork, and really where we needed to add some additional capabilities. In that, the development work kicked off, and as well with partnership with AO and sharing our plans, our concepts, and our use cases. We've now been able to pilot this data capture app, this fork app, in Kenya, Lesotho, Malawi, Zimbabwe, and I'm currently piloting it in South Africa this week. So we're definitely continuing to make sure that it's doing well. And then there's going to be continued dev iterations based on feedback and based on the learnings. And while some of the functionalities have now we're seeing come through in recent iterations of or recent versions, we do hope that by the end of 2022, that all of these capabilities will be part of DHIS2's core, and will also be, of course, sharing guidance documentations in our experience, as well as capacity building materials for these tools. So I'll hand over to Christina.
Thank you so much, Amber. So, as anticipated by Rodrigo and Amber, we have two main use cases of the work that PSI has been doing on this fork version of the DHIS2 capture app. And I'm going to talk about the first use case, that is how to use DHIS2 for clinical quality improvement. So, as mentioned, at PSI, we use the Keystone Approach to deliver a digital health intervention. So, the first phase of the Keystone Approach is the diagnose phase. In this phase, we think about what are the unmet needs in the market. In this case, what are the unmet health needs in the market that we work in, and we basically try to identify who are the users and what are the needs that we want to address. And so for in this example, so basically we have identified the need to support the health supervisors in their day-to-day activities during supportive supervision visits. And we wanted to offer them a tool for managing their routine activities with the health providers. So we have developed a tool called HNQS, Health Network Quality Improvement System. This is an electronic tablet-based tool that aims to improve quality of health services in healthcare networks and manage and reach health impact at scale. So the tool, the HNQS tool, is an Android custom app which is synced with the DHIS2. It has 4 modules, and it helps health supervisors and health system managers to plan supportive supervision visits according to a prioritization matrix that takes into account the quality of care scores and patient volume at provider level. Then it walks the supervisors through an assessment checklist to assess the provider's quality of care against the standards. At the end of the assessment, the supervisors are able to conduct a feedback and improvement session with the providers to improve their quality of care standards through a tailored on-site feedback. And then the app also offers a monitor module where the health supervisors can basically track the quality improvements over time. So HMQS is, as I said, is a custom Android app that has been in sync with the PSI servers of DHIS2. So we have used it since 2015 in over 30 countries. To assess health providers on 13 different health areas. We have reached quite a high number of health assessments conducted with this app on more than 84,000 at over 8,000 health facilities. So we've definitely used this custom Android app in sync with DHIS2, HMQS a lot. And we have reached I would say a good point in terms of scale and a lot of experience and lessons learned. However, at some point we realized that we weren't building for sustainability because other partners showed interest in the tool, and we couldn't easily hand it over and open it up to other partners and implementers. First of all, to other ministries of health. So we basically decided to press pause on the implementation of this tool and think of what else we can do to make it available to the whole DHIS2 community. So we have moved on to the side phase of our Keystone approach, and we have talked about where we could intervene for the greatest impact. So what else we could do in order to offer this experience, this knowledge to the wider DHIS2 community. So we have identified a vision of success for a proposed out-of-the-box DHIS2 tool. So we wanted a DHIS2 tool to cost-effectively improve routine clinical quality of healthcare across public and private sectors. We have identified some challenges that the ministries of health have in terms of support and supervision visits, and we wanted to offer a DHIS2 tool that would respond to these challenges, mainly in the area of managing support and supervision visits cost-effectively at scale, and making sure that the data are collected and analyzed in real time, offer the possibility to provide on-site tailored feedback to the providers, better targeting of resources, because resources are usually stretched at country level, and making better use of DHIS2, and of course offer the possibility to overlay other data sources. So we basically identified this vision of success, what we wanted this tool to address in terms of health needs, and then we have set up to design this intervention, and we have designed it together with the users and other implementers, like for example the University of Oslo. So we definitely designed the tool with sustainability in mind, because we wanted to remove maintenance and tech support from our side, from PSI. We wanted to open this tool to other implementers, to the MOHs, and to other DHIS2 users worldwide. So we wanted to remove the need to maintain a custom Android app like HMQS is. So this way we would have been able to hand over all the maintenance and the tech support to Oslo, because if we build a DHIS2 global good for quality improvement of health providers, it would have been a part of core DHIS2, and this would have basically be something that Oslo would maintain as part of their routine maintenance work. So, and more importantly, as a core DHIS2 tool, it would have been used by any DHIS2 user worldwide, from MOHs to other implementers and other organizations. This is a This aligns very well with the principles for digital development that we have seen at the beginning of this presentation. And it will also have allowed PSI to work more with partners and to increase the user base. And when you have a higher user base, you are able to collect more feedback from the users and to refine the tool for better fit for purpose. So we basically design it, and then we have delivered it. That is that we have started doing the actual interventions to address the health needs that we have identified. So we have built the tool on a forked version of on a PSI's forked version of the DHIS2 Android Capture app. So at the moment, this has been this is available on PSI's forked version, and as we have seen in the roadmap, we have a goal to transfer everything into core DHIS2 at some point in 2022, according to all those timelines. So what we've done in DHIS2. So basically, we have tracker programs as any DHIS2 tracker program. The tracked entity are the org units, in this case, the health facilities. So a health supervisor opens the DHIS2 Android Capture app on their tablets, on their smartphones. They select the health facility where they want to conduct supported supervision visits. They select the health area, and then they add a new assessment. They conduct the assessment following an electronic supervision checklist. And then at the end of the assessment, the tool will basically automatically calculate quality of care scores and section scores. Rodrigo, can you move to the next one? Okay. The tool will basically automatically calculate the quality of care score and section scores, and the providers will discuss with the the supervisors will discuss with the providers the results, and they will agree on an action plan. The supervisors will share the action plan, and then they will also decide the date of the next support supervision visits. All of these is data that is captured in real time in the DHIS2, and then in DHIS2, you know that you can have a lot of dashboard and visualizations for supporting the decision-making process of the health system managers. So where have we done this? So as of today, we have done 2 pilots in 2 countries, Malawi and Zimbabwe. So we have configured the USAID external quality assurance checklist and 8 BMMC checklist as DHIS 2.0, as checklist in this out-of-the-box DHIS2 tool. And we've used it at the moment in 16 health facilities in these 2 countries. With over 250 assessments conducted so far, we are learning how the tool is useful for the users. We are gathering their user feedback, and we will use it to further refine the development of this tool. With this, I'm done with the part on how to use DHIS2 for improving clinical quality, and I will hand it over to my colleague Amber, who will talk about routine data quality assessment.
Thanks, Christina. So building on the lessons learned from HQIS 1.x and the developments that we were experiencing with 2.0, at the same time, we diagnosed the need really for a way to digitize our RDQA work. So for those not had the pleasure to go on an M&E RDQA visit, that's your routine data quality assessment. So this is a fundamental part of what M&E teams do on a routine basis. This is so that we ensure that data is being reported reliably, it's accurate. Oftentimes, the tools that we use for RDQA they're often paper-based or they're Excel-based. Most of us are familiar with the measure evaluation tools from a few years back that are still in use today that PSI and other partners have modified for their use. They're fantastic tools, but you still have to aggregate these reports. You have to convert them into an RDQA report. And then you have, so you slow down your dissemination. You know, I've seen in the past where teams are actually on to the next RDQA visit before the previous action plan has been implemented and really disseminated. And then what happens is, just with a lot of these paper tools, this printed out RDQA narrative ends up in a stack on your desk collecting dust, or it's, you know, buried in your emails, you know, really deep down there, and you're never going to find it. So that was definitely a need that we needed to address. So we decided that we needed to design a digital tool that's going to make it easier for our M&E teams to conduct RDQA visits. We want to reduce their reporting burden. We need to be more agile. We need to be able to report more rapidly, and we need to move on to the next and continue to support and improve our processes. We also wanted to increase the transparency of these visits by using DHIS2, because this is also the same place where our program reporting data is being collected. So why not have our RDQA sit in that same place? And of course, we wanted to build on existing RDQA M&E principles and tools that the M&E teams have adopted. So we had to design something that met those pieces. So with that, we had to design this tool in DHIS2. How do we configure around this? So the way that the RDQA tracker program is designed, there are 3 key stages, and we have 2 additional features. So the 3 key stages, we have the system assessment. So again, for those who don't go on M&E RDQA visits, this is where we do a qualitative assessment of strengths and weaknesses of the data management and reporting systems at the facility or clinic that we're supporting. The next, of course, is the data verification itself. We identify the causes of poor quality data by we assess the ability to manage, collect, and report quality data. The action plan then. So now we've actually looked at, does the data match what we're seeing on the ground with what was reported? Are there M&E systems in place? Are they strong? We create an action plan to help improve and strengthen the data management and reporting systems so we can improve data quality. So really key stages here. 2 additional features that we leverage are indicators. So we give immediate calculations to the assessor. So whoever's conducting the routine quality assessment on how the site did based on the data points that are being entered, and supports that supervisor or that assessor by giving immediate results and feedback to the site and how they performed. And so from the feedback as well, this is also a feature that's unique to this fork that can help highlight past and failed scores and standardized guidance to highlight in this debrief as well to accompany the action plan. So then lastly, it became time to deliver. And so what I've shown here is, I'm sure it's probably quite small now through technology, but just to really show that with our pilot, we've now conducted, I believe, over 700 indicator assessments, and we've operated in over 10 countries now. And so we're hoping to move forward to phase 2. We want to iterate based on feedback from our country teams and anyone in the community and anyone else who's using the RDQA configuration that we've created. And you can just see, this is a simple dashboard that I wanted to just share, where we can see countries, and we can see their overall data quality score, their system assessment scores, and their data verification scores. So this is just one of the high-level dashboards that we've created. So, you know, regional managers, regional support teams can quickly see how countries are doing. And then, of course, by using the analytics features within DHIS2, we can dive in and go down to the facility level and go, you know, down into the details as much as we need. Okay, and so we were able to deliver this, you know, based on the learnings and the tool from HNQIS 2.0 that Christina mentioned, that same DHIS2 fork app. So why are we sharing this with you today? One is we're really excited about what we've been working on, and it's been really fantastic to see this transition and start to have more of this mobile work happening, and allow us to create these supervision visits more frequently, collect this data faster. So if you're working on clinical quality, reach out to, you know, collaborate or chat. This is our first call to action to those participating today. Clinical quality, data quality, you know, whatever walk you're from, or if you're on an MIS team that's been trying to figure out a way to support, we definitely want to continue to design together, collect more user stories and use cases as we continue to iterate and scale up. You know, if you also have any tools that you've developed that you would want to, you know, share back into the community as well on clinical data quality, especially, you know, we'd love to see what others are doing. And lastly, we just wanted to highlight as well that the work that's been done for the RDQA configuration is now, thanks to some of our team members that I think are on the call, it's now published to GitHub. And so it's github.com/psi-org/RDQA. And I think this will be shared later, but we have a GitHub page going up that we welcome you to explore. There's a wiki, and again, if there's any feedback on there and questions, you know, feel free to reach out to the three of us today. So with that, I'll hand back over to our moderator.
Thank you. Thank you very much. That was a very informative presentation. You really packed in a lot of stuff in the time, and very interesting to see the work that you're doing and the impact that you're having around the world. Now I would like to turn it over to our participants. And if there's any questions or comments, anything you're wondering about, would like to share, please do so. You can type in the Q&A feature, and this is the prime time to speak to the experts. We have them for about 10-15 more minutes, so please take advantage of them being there. Someone has commented that, you know, great work, and thank you so much for sharing. As we're waiting for people to type in their questions, I was just wondering, you're piloting in several countries, and I'm just wondering, do you have any examples of the feedback that you received from the test users, the pilot users, when you were in those countries?
So I'll jump in on the HEQIS pilot for 2.0. So this one has been really nice because a lot of the users who are using 2.0 have actually used 1.6 or one of the 1X versions previously. And so one of the things that's really exciting now that we've moved into this new approach is the ability to do data capture. Although you don't have the full functionality, being able to use the tracker capture app directly in Chrome, you know, through the DHIS2 website, which has been a really great feature for those that may be sitting at a desk and want to type out an action plan. And so that's been really well received. And we've also included, so it's also allowed more hybrid approaches to both RDQA and HEQIS, where there's obviously, we're social distancing right now for this conference, but we've actually, with this, the HEQIS pilot, we actually did it as a hybrid model of in-person as well as remote. So because of the power of video calls, we were able to actually have, this pilot was a mix of people sitting in Washington, D.C., within the country offices at facilities. So we had people in 3 different locations collaborating on these supportive supervision visits. And so it was really able to kind of adapt to our situation today. And it was the first time that some of the teams on RDQA had seen data and these action plannings coming in real time, and able to immediately see the opportunities for improvement in real time, rather than waiting for an email to come a month later when you're already on to the next action item. So I think that interaction was really appreciated by a wider group of people that got to kind of see into what was happening.
Great, thank you. Yes, kind of adapting to the times, and like we've seen with this symposium, we're able to reach, because we're going virtual, we were able to reach a wider audience. We have a comment or question in. says, this tool looks fantastic. Have you guys had any conversations with health financing teams or projects? Health financing programs often include a verification component with very similar data collection needs to an RDQA. So
I haven't. I don't know if Christina, I don't know if Christina has.
We haven't had any conversations about including health financing components to this tool. I would say the architecture of the tool, if you pass me the term, allows to accommodate a very large variety of checklists of questions. So as long as you want to know more about how well providers, health facilities are doing in a certain area, for example, health financing, there is the possibility to accommodate that type of information in this out-of-the-box DHIS2 tool. But we haven't done any work on this.
I think perhaps just adding on that, I think Blue Square, if I recall correctly, in one of the previous symposiums, had some questions because I think a lot of the work that they're doing has to do with result-based financing projects in Burundi. So we're thinking how they could leverage this tool for that. But I think that was more like a discussion. And again, back I think it was 2 years ago, where HNQIS wasn't really fully ready to be transferable. We kind of like just end this conversation. So that's one, I think, one of the main aspects why when we're developing something and kind of like this is kind of like the thing that we just keep in the back of our heads now, it's transferability. Are we developing something that can be transferable to others, to, in this case, Blue Square or the MOH or someone who can then take this technology and be able to easily plug it in within their digital ecosystems. But yeah, no, that's, yeah, we would like to, if you know of any other projects or other people, then perhaps that would be an interesting collaboration as well. Thank you for that.
Yeah, great. We have another question that's come in. Thanks for this session, very interesting. I'm wondering if the methods to conduct the RDQA are the same as recommended by Measure, or if the methods changed at all with this DHIS2 configuration.
Yeah, so for the most part, I could say that it's if the measure evaluation tool from Excel was turned into a DHIS2 configuration. We're collecting the same data points, even the questions on the systems assessment, they're all there. And now that I haven't done a side-by-side in a while, but it is definitely, I think 99% the same. I would love to, also if anyone's interested to look at it too, to see if there's any gaps. But that was part of our design, was that we didn't want to completely change how RDQA teams were used to conducting the process. And so we tried to mimic that as much as possible. And that was a lot of the challenge.
Yes, this has been a great presentation and discussion. And we still have a few minutes left. So I think I see another one in the Q&A. Apologies if I missed this earlier. How easy would it be to tweak the configuration to add or change data elements? Could that be done through the UX?
I can take that. Thanks, Vivian, for your question. So sure. So one of the objectives that we want to achieve with this tool is that it can be transferred to any other interested partner, and of course they can adapt it to respond to their needs. So if, for example, you want to add, delete, change data elements, this is absolutely totally doable, because think of this as a tracker program that you can customize the way that you want based on the data elements that you want to have in the tracker program. And then you use the tracker program to basically assess, collect scores on site, and then plan, do something after the assessment and the scores. And so this is absolutely doable. From my side, I want to, so where all of this is coming from. So as we've said in this presentation, we have done a lot of work to develop tools, and we have used DHIS2 to basically respond to our program needs. We want to be more collaborative with the rest of the DHIS2 users and to open our tools to the community. So I would encourage to have conversations. I mean, whenever possible, we all live in a very connected world these days. So we are just a couple of links away by emails, Twitter, Teams, whatever channels make you fits you better, to have conversations, because in some cases there are the opportunities to collaborate and test things and to avoid reinventing the wheel and maximize, and this will help us maximize investments in these tools as well.
Just to thank everyone for being here and hoping that next time we can also do this in person. But yeah, thank you so much, everyone.
Yes. So
And thank
I want to.
the rating.
Yes, thank you. Thank you, PSI, and thank you to our participants.